In this video, we'll be discussing the comprehensive care pathway implemented to improve outcomes following a radical cystectomy. Being diagnosed with bladder cancer and making the decision to have your bladder removed is quite overwhelming. The goal of our experienced medical team is to provide you with step-by-step, manageable pathways which we can walk you through one step at a time. Once the decision has been made to undergo a radical cystectomy, we will begin the process of screening you for any modifiable risk factors. One of the most common and important factors is whether or not you're malnourished, which studies have shown would place you at increased risk of having a perioperative complication. In those patients we identify at high risk of malnutrition and cachexia, trained nutritionists will create an individualized strategy for improving nutrition and providing dietary goals. This is especially important in patients who have received preoperative chemotherapy, where taste and appetite can change dramatically. Next, patients will be screened for bowel dysfunction and constipation prior to radical cystectomy. We know that bowel dysfunction is one of the most common complications after surgery, and therefore, if we screen you and find that you have bowel dysfunction, we may start you on a regimen of stool softeners and/or laxatives. Prior to surgery, patients will be provided with accelerometers to wear on a daily basis to track your walking and activity. Your goals will be tailored towards you, and the amount of activity that we request you to perform will change on a daily basis. This will help with your heart, your lung function, and overall physical health, and will make your recovery from surgery much easier for you. You may not be able to meet all of your goals right away, but we are going to encourage you to try and keep working at it. Once you move to the surgical phase, we have implemented a pathway to assist with decreasing complications and shorten your hospital stay. Our goal is to let you return to the comfort of your own home, ideally by 4 days after surgery. In order to achieve these goals, we have incorporated proven strategies, including medications to block narcotic absorption in the bowels, long-acting local anesthetic medications to decrease the need for narcotics, and early refeeding after surgery. Additionally, we will continue to encourage you to walk throughout the entire hospital stay with step goals each day. Once you are discharged home, our goal is to decrease the likelihood of you having to come back into the hospital, which some studies show can be as high as 20 to 25% of patients. At home, we will provide equipment for us to monitor your vital signs and some easily gathered data such as your blood sugar and weight. Additionally, you'll be given reminders about taking your antibiotics, blood thinning medications, using your breathing machine, getting up and walking, and flushing your neobladder if applicable. We'll also be monitoring for dietary intake and provide nutritional support. Most importantly, our comprehensive care pathway will provide multiple avenues for you to communicate with a member of the treatment team in real time in order to identify areas of concern preemptively and react accordingly. It's clear that radical cystectomy is a difficult operation to undergo. Our team has created this comprehensive treatment strategy to help improve your outcomes.